Hello students, today we are going to discuss regarding a new topic which is ocular emergencies. As you know, ocular emergencies means it's a emergencies relating to the eye conditions. That is regarding as the ocular emergencies. We can deal in detail. So the common ocular emergencies seen in an ED. There are mainly the trauma and non-trauma are the main emergency, and the trauma means it may be penetrating blunt trauma or due to the chemical or thermal burns also. Then the non-traumatic means that is the infectious and non-infectious cases, and the infectious cases means orbital cellulitis, then orbital abscess and the presbytal cellulitis. These are the infectious cases, and the non-infectious cases means acute closed angle glaucoma, then retinal detachment, and CRVO and CRAO. That is the ocular problems. These are the main emergencies seen in the emergency department. Then the ocular emergencies are mainly divided into two types, that is the non-traumatic and the traumatic. Then traumatic means that is a blunt and penetrating trauma, and the blunt trauma means that is a periorbital edema, then the orbital fracture, EOM palsy, that is extra orbital muscular palsy, then hyphema. The hyphema means that's an infectious case. Then said the hyphema is a pooling or collection of blood inside the anterior chamber of the eye. That is the hyphema, pooling or collection of the blood inside the anterior chamber of the eye. Then the penetrating trauma, that is the lid laceration, then conjunctival or scleral, corneal perforation, and the cataract. These are the some of the examples of the blunt and penetrating trauma. Hope you may remembering that all we already discussed regarding the eye trauma conditions and all. So again the ocular emergencies are divided into two types, that is the medical and surgical emergencies. The medical emergencies means that is the conjunctivitis, iritis, then periorbital cellulitis, then the glaucoma, central retinal arterial occlusion. These are the medical emergencies. And the surgical emergencies are the corneal abrasion, extraocular foreign bodies, retinal detachment, orbital fracture, chemical burns, hyphema, and the eyelid laceration and the globe rupture. These are the surgical emergencies. So it's divided into medical and surgical emergencies. The medical emergencies means conjunctivitis, iritis, periorbital cellulitis, glaucoma, central retinal arterial occlusion, and the surgical means that is corneal abrasion, extraocular foreign bodies, retinal detachment, orbital fracture, chemical burns, hyphema, and the eyelid laceration and the globe rupture. These are the surgical emergencies. And the ocular trauma is divided into closed globe and the open globe, means depending upon the injury to the globe. Then closed globe means again divided into burns and laceration. The burns means that may be chemical burns or radiation or thermal burns. And the open globe means that is rupture of the globe or the laceration, that means penetrating or the perforating type of trauma. These are the other classifications. Then eye examination after a trauma means once there is an emergency case we are seeing and that's a penetrating trauma and all, what we have to focus, that is one is visual acuity. Visual acuity means we have visual acuity or orbit examination, periorbital skin examination, eyelid examination, confrontation VF, and the ocular motility. These are the things we have to examine. And the visual acuity means we have to assess the visual acuity by the finger counting. FC means finger counting, then HM means hand motion, and the PR means the perception of light. These are the different ways to analyze the visual acuity. Then we have to examine the orbit for any fracture, that is floor or wall fracture we have to analyze. And the periorbital skin we have to look for the hematoma formation. Then the eyelid we have to look for abrasion and laceration. Then the confrontation VF means the visual field we have to assess whether any defect is there. Then the ocular motility. These are the main things what we have to look into a patient immediately after the trauma and all. Then the examination after trauma include the anterior segment, and especially we have to look for all the parts of the eye, which including the conjunctiva, cornea, sclera, then anterior chamber, then iris, lens, pupils, and the IOP. All these things we have to look, and these all things we have discussed in detail in the eye trauma itself. Then next one is we have to look for the subconjunctival hemorrhage. Look into the picture. In that you can see the formation of the subconjunctival hemorrhage. That is the formation of the subconjunctival hemorrhage. And we have to look for the history of the redness or discomfort or burning sensation, then blackish shadow around the side of the eye also. These are the things what we have to look in a case of the suspected case of a subconjunctival hemorrhage. Then the corneal abrasion. Once there is a corneal abrasion like this, means this and all, is easily visible. Once there is a corneal abrasion, we have to look for the history of blurring of the vision, redness, pain, photophobia, then the foreign body sensation, then watery eyes or swelling of the eyelid. And we have to look for the corneal abrasion by doing the epithelial staining defect with the fluorescence also. These are the main things what we have to look. Then the traumatic hyphema means that's a pooling of the blood. That blood in the anterior chamber will be there. From this picture it's clear that there is a pooling of the blood in the anterior chamber and loss of vision, then severe pain, redness and the photophobia. These are the main things in the hyphema formation. Then the lid laceration, the causes are sharp or blunt trauma, then history of full thickness cut injuries, then BUL, LUL, medical, cancers, redness, watery pain, then bleeding and the vision may be dim. So these all things we have to look. The lid laceration you can see in this picture, that is the lid is lacerated in in the outer corner of the eye. Then the lid laceration with canaliculi, that is the puncture and the upper and lower and canaliculus, all those things which all the inner canthus, all the things are getting affected and the eye getting more it's a case which may require an immediate surgical recovery. In the penetrating of the ruptured globe, that is a corneal or scleral laceration, then hypopene, then severe chemosis, hemorrhage and intraocular foreign body may be present, and the limitations of the extraocular motility will be there, and shallow anterior chamber and the irregular pupil will be there. That is the penetrating or the ruptured globe, the complete rupture of the globe. You can see in this picture that. Then the chemical burns and what we have to do. The immediate copious irrigation with a minimum of 2 liters of saline or until pH is normalized. Means we have to stabilize the pH, that is in between the 7.3 and the 7.7. We have to maintain the eye pH and instill a topical anesthetic. We have to instill topical anesthetics and use eyelid retraction in order to open the eye properly and to do to proceed with the irrigation. And the double eversion of the eyelid we have to do. These are the things what we have to do in case of a chemical burns. Then in non-traumatic condition like the corneal ulcers, then hemorrhagic conjunctivitis, corneal retinal artery occlusions, orbital cellulitis, acute ankle closure glaucoma, endophthalmitis and the retrobulbar optic neuritis. These all are the different non-traumatic cases. The corneal ulcers means there will be the blurring of the vision and the white spot will be there. Then hypopene means that is redness, foreign body sensation and the watering and the pain. These are all the things what we have to see in this case of the corneal ulcer formations. And the hemorrhagic conjunctivitis means we already studied about the hemorrhagic conjunctivitis. Mainly we will be seeing the symptoms like pain, redness, watering and mild photophobia, and there will be blurring of the vision and the lid edema formation. And the signs will be conjunctival congestion and the chemosis, then multiple hemorrhages in the bulbar conjunctiva and the mild follicular hyperplasia and the lid edema will be there. So in such cases we have to get it and correctly we have to do the particular management. Then the ankle closure glaucoma, this already we are dealt, and a red eye blurred vision with the halos and the nausea and vomiting will be there, and there will be conjunctival congestion and the hazy cornea, then shallow anterior chamber, fixed mild dilated pupils, and IOP will be 56 millimeters of mercury. So we have to look for the particular case. And the central retinal arterial occlusion, once there is a retinal artery occlusion, and in all the cases, all means once there is an occlusion, then the particular part before the occlusion will not be getting accurate supply of blood, and so the particular part will be getting necrotized and all. So that is a acute painless loss of vision in the right eye or visual acuity in 90% of the cases, and opaque white retina and the attenuated vessels will be there. These are the things in the central retinal artery occlusion. Once there is an arterial occlusion, then the particular part after that portion will be getting will not be getting enough blood supply, and because of that the function will be decreasing, and immediately there will be vision loss will be there. Then the orbital cellulitis, that is the periorbital erythema and the edema formation, then proptosis, then restricted extraocular motility, then decreased visual acuity, then chemosis, fever, and severe swelling around the side of the eye will be there. Then the endophthalmitis, that is this is a rare but very devastating complication, and the acquisitive organisms after the infections and all. Then loss of the vision, severe pain, redness and watering will be there, and there will be discharge also. Then the hyphobia may be present along with this case also. That is a endophthalmitis. Itis means it's a infection and inflammation. Then the retrobulbar optic neuritis, that is a visual loss in right eye and pain on the eye movement. Visual acuity will be 6 out of 60 or 6 out of 36 and all, and there will be RAPD, that is the relative affected apparent pupillary defect will be there. Then positive OD. OD means the ocular dexter, and that's a Latin word which indicate the right eye. Especially there will be problem along with the right eye, and there will be VF central scotoma OD. VF means that is a visual acuity. These are the things in the optic neuritis. Then the acute eye conditions are divided into emergency, very urgent, and the urgent conditions. And the emergency conditions which require immediate care, that including the retinal arterial occlusion and the chemical burns. And the very urgent within a few hours, that is a perforation, ruptured acute glaucoma, then sudden congestion and the proptosis. And urgent means within the 1 day, that is orbital cellulitis, orbital injuries, corneal ulcers, then corneal abrasion, then hyphema and the intraocular foreign bodies. These are the different categories of cases which based on the urgency of care. Then the prevention of eye trauma. The prevention means all the persons who are aware of their eye and who are aware of their work and all, they should be more cautious about their atmosphere, and you must encourage them to use proper protective measures. About 60 of the workers who suffer in the eye injury did not wear eye protection at the time of the injury, and appropriate eye protection is the most important single intervention, and the assessment risk of operations and the exposures are also good, and visual checking in routine health exams and planning for eye emergencies and the engineering modification can be assembled. That we have to use the eye covering. Eye shield should be used in case of the those who are at the using the chemicals in the lab or out those who are doing the industrial work and all, they should use the eye protective measures, and once they did not use, they are at higher risk for developing such cases, and they should be more aware about the risk of eye injuries and the further visual loss and all. So we have to encourage the use of preventive measures, and also we have to think for the engineering modification along with the or in case of the chemotherapy and all, we will be using the special cubicle to load the medicine, and we will not be exposing to the drug directly. So in such modification can be planned and implemented to the clinical field in order to reduce the exposure of the eye and in order to reduce the eye injuries. So these are the main things regarding the eye injuries, and also thank you.